Dr. Ong, do you come across patients who resist starting blood pressure medications because they think that once started, they must be on it for life? Do you come across patients who think that once started blood pressure medications, they must be on it for life, cannot be stopped? So they constantly try to push back, constantly try to delay it, or may even default follow up with doctors because they are afraid they will be under pressure constantly from the doctors to start medications which they would not be able to get off for the rest of their life. What do you think of such a perception? How common do you encounter that?
I see this every day, every single day. I have
Mm.
no idea where the logic comes from. My answer to them would be because unless their lifestyle have changed, unless
Yeah.
they've lost weight, unless they've changed their diet, then the blood pressure medication is with them forever. If they can change their lifestyle and diet, yes, it's possible that the medication can be stopped.
Certainly, I share your frustration as well, and also wondering why, but more importantly, how we can change this misconception in the community. So, whenever I give talks, or whenever I conduct training, coaching programs, or even when I'm seeing my patients in the clinic, and I always tell them not to treat medication as this poison, this must avoid at all costs, right? But the important thing is to look at medications as something, right, that's if it's necessary to be taken to tackle the problem immediately, to bring it down to a safe level, but at the same time cannot afford to depend on that alone,
Yes.
but must immediately, the best possible effort, mount a concerted, comprehensive overhaul of their lifestyle and especially the exercise and eating habits. And when the blood pressure is becoming better controlled, there's every reason. No doctors want to keep their patients on medications for blood pressure control forever just for the sake of it.
I think both of us are the same. Nothing gives us more pleasure than being able to stop hypertension medicines. If the person has made the changes in their lifestyle and the blood pressure has come down, nothing gives us more pleasure.
And we want to share with the people watching this video. Number one, work closely with your doctor. Do not be afraid of starting on medication, but do not depend on it alone. Even if you have already been started on medication for blood pressure control, work with your doctor, your medical team to do whatever that's necessary to improve your lifestyle, your exercise, your dietary habits, right, and monitor your blood pressure. And when become better, right, work closely with your doctor to titrate, to calibrate, to reduce, and maybe possibly a good chance or even stopping it. But work with your doctor. Do not stop your medication on your own. I hope you have enjoyed this episode of Doctor's Conversations about the power of lifestyle habits as medicine. Let's unlock the power of lifestyle habits as medicine, one habit, one dose, one day at a time.